What has been the highlight for you from our meeting of the Melanoma International Patient Advocates Coalition? I've really missed this meeting for the last 3 years and getting in a room full of people who have got the same passion, the same vision, goals and ambitions. It's mind-blowing for me. I've really missed it, to come into a room full of people like our advocates and again sharing best practice. You know, clinical trials is a major thing for all of the countries, and there's so much difference everywhere in the world. Gaining an understanding of what difficulties are going on around the world and things that we can learn from other countries that are doing so well. I've really loved it, and being introduced to 2 new pharmaceutical companies that are actually doing trials in the UK was a major takeaway for me, because now I've got the link and I can start working with them back home.
Our coalition is just amazing. I'm in the coalition for the last 6 years. It's sharing and meeting friends from all over the world, hearing what they do, to learn from them, to show our association the benefits and the achievements, and to go together to listen to the highlight of the ASCO together.
The highlights is how the treatments changed, how many new treatments we had. We started the association in 2014, and in 2014 I just had a friend who died from melanoma because there were no treatments. Now we have treatments in almost every stage. The patient is being taken care of at the very beginning, and the diagnosis changed so much because people start learning about melanoma. The education is working, and melanoma is a cancer that can be treated very well if it's taken at an early stage. So this goes through the dermatological visits, through the prevention, through the use of sunscreens and all these things, and patients start knowing that. So these are the main highlights for us, the treatments that came out and the possibility of treating the patient till the very end, but also from the very beginning.
It's so good to hear what you're doing in your organizations. It's wonderful to hear the experience and all the activities that we're doing. So it inspired us to do the same thing or improve what we are doing in our countries.
What I really enjoyed the most was getting to see everybody in person. I mean, we do talk to each other and we work with each other throughout the year, but being in person, it gave us a much greater opportunity to share ideas, discuss challenges we each facing in our communities, and then how do we work together to address them over the next year. So now we get to return home and we can use the information we learned in order to better support melanoma and skin cancer communities.